Good morning, everyone. Thank you so much for joining this morning. I am going to be walking you through a PowerPoint this morning that touches on incorporating animal-assisted interventions within the autism community. Today, we will touch on a review of the various different types of support dogs. We'll learn more about the human-animal bond and animal-assisted interventions. We'll explore the connection between autism and co-occurring mental health diagnoses, and we'll also look to explore the advantages of integrating animal-assisted interventions into autism. We'll first start by discussing the various types of support dogs, as at least here in the US, there does tend to be a good deal of confusion surrounding the varying types of dogs. Today, we'll mainly focus on therapy animals. Therapy animals are dogs and other species such as cats, alpacas, guinea pigs, etc., that play a specific role in physical, emotional, or therapeutic treatment services. And this may look like a dog working in a classroom for special education students, things of that nature, working at a hospital. The next category of dog is an emotional support animal. And that dog does not get any sort of specialized training. It is most often someone's pet, and a medical prescriber prescribes that pet to the individual to mitigate any challenges that they may be experiencing from their mental health diagnoses. Lastly, there are service dogs, and service dogs are specifically trained animals that are matched with a partner with a disability. And service dogs are trained to do specific tasks for their handler that mitigate the effects of their disability. You will note that each of these dogs go through various different types of training processes, have different legal protections here in the US, and also do a variety of different work. Here you will see a breakdown and summary of the types of dogs, and you'll be able to denote that only service dogs have the ability to enter all facilities with their handler, to not be discriminated against for housing, to travel on an airplane, etc. You'll see that therapy dogs, which we'll be talking the most about today, have very limited protections. And this is because they are people's pet dogs that are most often working in a volunteer capacity. Before we dive into animal-assisted interventions as a whole, it's important to understand the significant impacts of the human-animal bond. As you heard in my introduction, I am very passionate about working with dogs. You'll see here on the left-hand side a photo of myself and my dog Lola, who is certified as a canine good citizen and works from time to time as a therapy dog. And on the other side, you will see my late dog Cinderella, who was a trained therapy dog and worked in my special education classroom. I included these pictures to illustrate the strong connection that dogs are able to make with humans. In regard to the human-animal bond, you'll note that it is a relationship that's mutually beneficial. It doesn't only benefit the person, but it benefits the dog as well. It positively influences the health and well-being of both the person and the animal. And this is a term that was coined by Dr. Leo Bustad. And that was many years ago when founding the Delta Society, which is now known as Pet Partners, which we'll touch on a little later. Human-animal interactions is the larger umbrella term that goes over the variety of animal-assisted interventions we'll be diving into in upcoming slides. You'll note that human-animal interactions may include, but are not limited to, emotional, psychological, and physical interactions of people and animals and their environment. Now we will dive into the different types of animal-assisted intervention. Animal-assisted intervention is a therapeutic approach involving animals. It assists individuals in achieving specific therapeutic goals or improving their well-being, and it's conducted by trained professionals. So as we touched on a few moments ago, it's a common misnomer that only dogs can be therapy animals. But here in the US, therapy animals may include animals such as horses, miniature ponies, and even alpacas. These trained professionals that incorporate animal-assisted interventions in their work vary significantly. They may be a therapist or a healthcare provider, a mental health counselor, an occupational therapist, and here in the US, we even see animal-assisted interventions in places like courtrooms, juvenile detention centers, skilled nursing facilities, and much more. These trained professionals work diligently to incorporate the various different types of animal-assisted intervention, which include animal-assisted therapy, animal-assisted activities, animal-related engagement, and animal-assisted education. Now I will break down exactly what those terms mean for you. So we'll start with animal-related engagement. And animal-related engagement is a very unique approach to animal-assisted intervention in that it doesn't necessarily involve the animal being there and present. Animal-related engagement refers to any activity, interaction, or involvement that centers around or involves animals. This term incorporates a wide range of human-animal interactions and include activities such as pet ownership, animal-assisted therapy, education, volunteering at animal shelters, and much more. And I do apologize, I am fighting a cold, so if I sound hoarse, please bear with me. We will now discuss animal-assisted education. And animal-assisted education is something that you would most likely see in a classroom setting or being performed by an education professional. So in this approach, we will find that animals are incorporated, trained and supervised by professionals, and they go through different activities to work with students to learn and carry out specific educational outcomes. So you may see this in a primary school, in a college, but it recognizes the importance and the potential of animals to motivate, engage, and support their learners. Animal-assisted activities are activities that involve the animal but do not have specific educational goals or outlines associated with them as animal-assisted education does. And animal-assisted therapy is most often used by someone such as a mental health practitioner, or here in the US, we also find that our occupational therapists, speech therapists, and physical therapists often incorporate dogs into their work. On this slide, which is a little tricky to read due to the size of the font, you will see how the human-animal bond, which we first talked about, starts at the top, transitions into the human-animal interactions, and down at the bottom, you'll see specific examples of the different types of animal-assisted interventions that we just discussed in a bit more detail. So to recap, you'll see that the animal-assisted activities may include things such as hospital visits, stress reduction visits, workplace well-being visits, and more. You'll find that animal-assisted therapy, as I mentioned in the prior slide, can be incorporated into all sorts of therapies. And then animal-assisted education, which can be used for reading and literacy, human education, and more. We will now transition to discussing the effects of autism and mental health. As many of you likely know, autism often comes along with a co-occurring mental health diagnosis. You will note that folks with autism may have a variety of different mental health diagnoses in addition to their autism diagnosis, and that their specific mental health challenges can create issues for them in functioning and carrying out the highest quality of life. One UK study recently noted that autism in adulthood is most often accompanied by a mental health diagnosis in a high proportion of cases. And a recent 2019 article published by the Psychiatric Times noted that almost 72% of children diagnosed with autism also had an additional DSM-4 psychiatric diagnoses. And in this study, they noted that anxiety was the most common disorder. In this slide, you will note the most common diagnoses that we touched on in the prior slide, but there's other diagnoses listed here as well. Research shows that 40 to 50% of those with autism are also diagnosed with anxiety. 20% of those with autism may also be diagnosed with depression. 17% may be diagnosed with OCD. 50 to 70% with ADHD, and 39% with sleep disorders. In the United States, even prior to the pandemic, we were struggling with providing robust mental health services to the autistic community. Currently, within the United States, the average wait time for traditional talk therapy is 6 or more weeks, and the average cost for out-of-pocket therapy can be quite high at $50 to $150 per session, and sometimes even more. 60% of psychologists here in the United States are not accepting any new patients, and 40% of psychologists had a wait list of 10 plus patients. With this challenge within the mental health community here in the US, we as professionals have begun to wonder, what else can we do to support the autistic community while they're waiting to access these much needed mental health services? A lot of research has recently been conducted that proves the efficacy of animal-assisted interventions. So we wonder, what and how can we do to connect these autistic individuals with animal-assisted interventions as a complement to the mental health services that they may be receiving or waiting to receive? It is important to note that animal-assisted interventions should not be used solely in place of mental health services, but as a complement. So we're now going to touch on the specific benefits, and I will share some stories with you of these benefits that I have been able to witness firsthand in my work with my current therapy dog, Lola, and my late dog, Cinderella. You will note that there are various physiological benefits of using animal-assisted interventions in autism. It has been shown that it can decrease one's heart rate, decrease blood pressure, and also decrease anxiety. The physiological benefits while interacting with a companion animal or a trained therapy animal can have this effect on those that they are interacting with. There have been recent studies that have shown in hospitalized children a significant decrease in systolic blood pressure after interacting with a therapy dog. Also, in terms of animal-assisted therapy, research has suggested that animals may also divert attention from someone from their own anxiety-producing feelings to thinking of something else, with the dog acting as a buffer. This is something that I often saw in my special education classroom with Cinderella when she would come in to work with my group of students. So often, if they were going through a really challenging situation or experiencing a high level of anxiety, doing something such as taking her for a walk, taking her to the gym to throw her ball for her, or one student who even recorded a talk show with her. These strategies would be used to help the students be able to take a step back from whatever it was that was bothering them, redirect those anxious thoughts and feelings, spend time with Ella, and then be able to return to the task or to the stressful situation after they had been able to regulate a bit. We have also found that there has been significant social and emotional benefits found in using AAI with the autistic community. You'll see here that studies have noted an improvement in emotional connection, improved communication, and enhanced social skills. One of the things that I love seeing with animal-assisted intervention, and particularly dogs, and the children with autism I've worked with, is how the dog can really act as a safe buffer for someone. So as many of you know, individuals with autism have a hard time at times making new relationships, feeling comfortable introducing themselves to someone they may not know that well. But if there's a dog present, it gives them a common ground to be able to interact socially, not only with the dog, but others that are involved. We have seen in the US that this is particularly relevant when children with autism are paired with service dogs, and that often they find other students in the classroom or folks in the community are more comfortable to engage with because they can talk about that dog. The young person doesn't have to talk about themselves or feel pressured to introduce themselves. They can just focus on talking about the dog. We've also found that research has shown that being around these animals can really improve communication. As I alluded to in the previous example, many individuals with autism do find it easier to connect with animals themselves as opposed to with other people. So I'm sure any of you that have a dog or a pet know your pet always provides for you a listening ear. They're not judgmental. They're not worried about if you're using full sentences. They're not worried about the tone or the pace of your voice. It really is a non-judgmental and safe thing to communicate with. And that really can mean a lot to someone on the autism spectrum. Both of those relate to the fact that this can improve social skills. As I said, helping, to be that buffer to feel more comfortable in new social situations. And it was also shown in a recent study that some young adults with autism may behave in ways towards companion animals that they would not with humans, and that their social interactions with animals would actually be contrary to the diagnostic criteria related to social communication. So again, for all of you dog lovers, I certainly know that there are times when I can pour my heart out to my dog much more easily than I could another human, and know that, I'm not going to be judged and I'm going to have that continued comforting presence. We have also seen that here in the United States, and also in some recent studies that have taken place in Europe, that incorporating animal-assisted interventions into the various types of therapy that I discussed earlier has been really helpful. We've found that it has increased folks' motivation. One study that I was reviewing recently talked about individuals that had a diagnosis of autism and had also struggled with past suicide ideation. And in this article, we read about the dog acting as a real motivator for these individuals that were struggling with pretty significant mental health diagnoses. Having that sense of responsibility really served as a way to keep them motivated to seek the medical treatment and attention that they needed, and also motivated them to do simple things like go to the grocery store or to go out into the community because they need to purchase food not only for themselves, but for the dog as well. It also encourages folks to get up and get moving, get out of the house, to take the dog outdoors to relieve itself, and things of that nature. Research has also shown that there has been an increase in focus and attention when one is incorporating animal-assisted therapy into an activity. We've also found that it helps with sensory integration, noting that interacting with animals can assist in helping individuals better process sensory information, and also boosting one's self-esteem. The successful and positive experiences that one has with an animal can really increase someone's self-confidence and self-esteem, which again better aligns them and prepares them for being able to interact with peers, people in the community, etc. So now that you have a strong understanding of what animal-assisted interventions look like and some of the things that they may be able to help with, you may be wondering, how can you access an animal-assisted intervention in your own community? There are a variety of different resources available that you can connect with that will help you to connect with either an existing AAI program in your area or be able to provide you with the guidance, knowledge, and support that you need to be able to start your own animal-assisted intervention program. So you will note on here that I, at Autism Barks, do provide consultative services. And in part of my certification as an animal-assisted intervention specialist, do have access to a variety of different curriculums and program planning that can be utilized to start a program in your own area. I've also listed the Assistance Dog International group because they are an agency that serves worldwide and provides a great deal of information on reputable programs throughout the world. And also, you can access the Association of Animal-Assisted Intervention Professionals. There are a variety of free resources on their website. And if you're interested in really learning more about this, they do offer courses and certification that you could pursue, and that too is available worldwide. I've also included a list of resources for you that you will see here in the next slide. And these touch on a variety of different topics. So you will see several of the websites that I mentioned here on the left. And then I've also included a list of books as well for both parents and professionals, as well as children. One book that was really great to read, and I actually listened to it on tape, was the book Dogs and Autism by Dr. Annie Bose. And Dr. Bose is an autistic individual who is also a veterinarian. And she has put together a comprehensive book on weighing the pros and cons of getting a dog or connecting your family member with autism with animal-assisted intervention. Her book does specifically focus on dogs, and it's really wonderful because it walks you through everything that you may need to consider, and also is very unique because it is written from the autistic perspective of Dr. Bose herself. And the books in the column for children are children's books that provide some information on dogs working in therapeutic settings, dogs that have made a difference. The Dog That Gave My Brother Words is a children's book about a young boy with autism who was nonverbal until a dog was introduced to his family. It's a really wonderful story. And the book that you see at the top, Ella, A Dog with a Job, is actually the children's book that I authored after Ella passed away unexpectedly. And in that book, you get to learn about all of the different therapy settings that Ella worked in with me. So that concludes the formal part of the presentation, and now I will open it up to question and answer. And it does look as if the question and answer section is open, so you can feel free to type any questions that you may have in the chat. And if there aren't any questions, I will certainly let everyone get back to their Saturday. I really appreciate you taking the time to participate in this presentation. I will connect with NeuroGen and share the slides so that you have them to reference. And please feel free to contact me with any questions that you may like to discuss one-on-one. You can find all of my contact information on my website, which is www.autismbarks.us. Thanks, everyone.